Psychosociology. Definition of psychosociology. The concept of a group. The various social groups. The dynamics of small groups. The dynamics of conflicts. The leaders. Interview techniques. Observation techniques. Group facilitation techniques. Communication and communication networks. Definition of psychosociology. Psychosociology studies the relationships between individuals, groups, and society. In nursing, it helps us to understand human behavior, communication, conflict, and teamwork, with a view to improving the quality of care. The concept of a group. A group is a collection of people who interact with one another, share common goals, and develop a sense of belonging. The psychologist Kurt Lewin regards the group as a dynamic entity, in which each member influences the others. Characteristics of a group: presence of several individuals, regular interactions, a shared goal, rules and standards, a sense of belonging. Example from nursing: a hospital ward's care team. Group of patients undergoing therapeutic education. Family of a patient. Importance in a hospital setting. The group allows cooperation, the division of tasks, psychological support, better patient care. The various social groups. Nurses interact constantly with three key organizations. A. The family. The family is the first social group to which an individual belongs. It provides socialization, protection, and emotional and material support. It passes on culture, beliefs, values, and behavioral models. En Santi. The family can support the patient by being there, helping with care, and making decisions. It can also be a source of tension, conflict, and pressure. Nurses must take into account the role of the family in patient care, providing information, offering support, and respecting family ties. B. The working group. A working group brings together people who share a common task within a professional context, for example, the nursing team in a ward. It is organized as follows: objectives: treating patients, ensuring continuity of care; roles: nurse, manager, doctor; rules, protocols, timetables, hierarchy; a culture of service, habits, ways of communicating, solidarity or tensions. For nurses, the working group has a significant influence: the quality of the cooperation, the working environment, conflicts, support, recognition, the quality of care. C. The institution. An institution is a broader category: a hospital, clinic, care home, school, etc. It comprises a structure, organization chart, management, departments, general rules, rules of procedure, procedures, a mission: to care for, to teach, to welcome. It sets out a framework for the care team and the patient, schedules, rights, responsibilities. The nurse therefore works within this institution, with its constraints and resources. The dynamics of small groups. Definition: a small group is a group of people who interact directly with one another. Example: a ward's nursing team, training group, medical staff. According to Kurt Lewin, group dynamics refer to the forces that influence the behavior of group member. Stages of a group's development. 1. training the members get to know one another. 3. Organization allocation of roles. 2. Conflict the emergence of tensions and disagreements. 4. Performance efficient work and cooperation. Factors influencing the group communication. Leadership, motivation, cohesion, common objectives. Benefits for nurses. Understanding the dynamics enables us to improve teamwork, to prevent conflicts, to improve the quality of care. The dynamics of conflicts. Conflict within a team, or with service users, is not an anomaly, it is a normal part of community life. It generally goes through several phases. Latency, unspoken tensions, or frustrations begin to surface. Trigger, a minor incident sets the crisis off. Escalation, positions are becoming more extreme, blocking communication. A conflict arises when there is a clash of interests, needs, values or viewpoints between individuals or groups. Conflict is not always negative. If managed well, it can help to clarify issues and improve the way things work. Types of conflict. A. Intrapersonal conflict, internal conflict within a person. B. Interpersonal conflict between two people. C. Group conflict between several groups or departments. Common causes of conflict in healthcare settings: work overload, lack of resources, misunderstandings, poor communication, differences in values regarding how to treat patients and how to speak to them, issues relating to hierarchy or recognition. Organizational issues. Management approaches may include avoidance, pretending that everything is fine, confrontation, regression, attacks, compromise, each side gives a little, collaboration, we work together to find a solution. Consequences. Negative stress. A decline in the quality of care. Tense atmosphere. Positive finding solutions. Improvements to organization. Effective conflict management. A nurse must listen, engage in dialogue, remain neutral, find a joint solution. Problem-solving techniques. Negotiation, mediation, compromise, collaboration. The leaders. The leader is the person in a group who influences others and shapes decisions, or the atmosphere, even if they do not necessarily hold an official leadership title. There are several forms of leadership. Formal leader, a person with an official status, e.g. a healthcare manager. Informal leader, a person who is listened to and respected, and whom others follow of their own accord. Types to leadership. A. Authoritarian leadership, the leader decides alone. Benefits: speed of decision-making. Disadvantages: stress. Low turnout. B. Democratic leadership, the leader consults the group. Benefits: motivation. Participation: active. Disadvantages: decisions can sometimes be slow. C. Laissez-faire leadership, the leader rarely speaks. Benefits range. Disadvantages: possible disruption. The best approach to nursing. Democratic leadership is often the most effective because it promotes communication, collaboration, staff motivation. Within a healthcare team, effective leadership helps to organize work, resolve conflicts, and maintain the quality of care. Poor leadership can lead to confusion, a lack of motivation, or tension. Interview techniques. An interview is a structured form of communication with a specific purpose: to gather information, provide support, assess, make an announcement, etc. Types of maintenance. A. Structured interview. Closed questionnaire, specific questions. Use in healthcare: initial data collection on admission, medical history, emergency situations. Semi-structured. An interview guide covering a wide range of topics. The patient speaks freely, but the nurse steers the conversation back on track if necessary. Use in healthcare: care pathway, therapeutic education consultation. Non-directive. Person-centered approach, Carl Rogers. Minimal prompts based on empathy and paraphrasing. Use in healthcare: psychological support session, e.g. receiving a serious diagnosis, end-of-life care. What makes a good interview? Active listening, respect, privacy, empathy, appropriate language. Significance for nurses. Allows to assess the patient, to understand their needs, to build a relationship of trust. Observation techniques. Observation is fundamental to nursing. It involves systematically gathering information about a patient or a situation without judgment. Types of observation. Observation direct, what one sees and hears, behavior, speech, posture, facial expressions. Participant observation, the carer observes whilst providing care, e.g. assessing a patient's anxiety whilst changing their dressing. Non-participant observation, a detached approach to analyzing an overall situation, e.g. observing the interactions between a mother and her newborn baby. Golden rule: always distinguish between objective facts, what I see, what I hear, and subjective interpretations, subjectives, what I assume or guess. Group facilitation techniques. Group facilitation involves organizing and encouraging discussion within a group. Objectives: encouraging participation, encourage self-expression, building cohesion. Key techniques. A. Brainstorming, free flow of ideas. B. Role-play scenarios. C. Group discussion on a particular topic. D. Case study analysis of a real-life situation. The facilitator's role: encourage participation, maintain respect, managing conflicts, clarify the objectives. Applications in healthcare: health education, staff training, therapy groups. Communication and communication networks. Communication ist elektronisch die Informations entre un emitter et un receptor, par des messages verbos, paroles, écrits, et non-verbos, gestes, regard, posture, ton de la voix. En milieu de soins, elle est central pour la sécurité et la qualité des prises en charge. A communication network describes how information flows within a group. Network centralized. A central figure, manager, executive, receives and distributes information. Network decentralized. Information flows more freely between members, a more horizontal team. In a healthcare service, there are several channels: oral briefings, handover, meetings, written records, patient records, treatment forms, digital tools, software, email, internal messaging systems. A good communications network must ensure the reliability, accurate information, the speed, especially in emergencies, the traceability, we know who said what and when. For nurses, effective communication means speaking clearly, listening, checking that the message has been understood, passing on important information to the team, and maintaining confidentiality.